Bismillahirrahmanirrahim. We are studying general anatomy. The topics we are going to discuss in this video are anatomical position, the different anatomical planes, and the directional terminologies. So, to learn the directional terms, we have to learn first of all what is the anatomical position. To learn about the anatomical position, it is a common visual reference point, means it is used to serve the purpose of reference during the further study. Like if we want to study the anatomical directional terms, we need to know the reference, for which purpose we need to know the anatomical position. So what is an anatomical position? In the anatomical position, the human standing erect, means the eyes looking forward to the front, the face directed forward to the horizon, the arms hanging by the sides, palms of the hand face forward, and the toes facing forward but away from each other, almost shoulder length apart. The feet should be shoulder length apart. So this is known as the general anatomical position. The palm face anteriorly with the thumbs pointed away from the body. So this is a visual reference point for the purpose of further study and dissection. For the description of relations and movements of various parts of the body, different imaginary flat planes have been proposed that pass through the human body. These are known as anatomical planes. So the commonly used planes are, first of all, the median plane. It is also called as mid-sagittal plane. It is an imaginary plane. It is a vertical antero-posterior plane that passing through the human body, that divides or bisects the body into approximately symmetrical right and left halves. So like this is our body if we consider it. Then median plane is the vertical plane in the midline, and it divides the body into equal right and left halves. The border of the plane, the anterior border of the plane, which bisects the skin surface at the front, it is known as the anterior median line, and the posterior border of the plane that reach the skin surface at the back of the body in the midline, it is known as the posterior median line. This median plane is also known as the mid-sagittal plane. So the second plane is sagittal plane. The sagittal plane is also called as parasagittal plane. Any plane which is parallel to the median plane is called sagittal plane. It also runs vertically, but it divides the body into unequal right and left halves. The median plane is also a sagittal plane, but median plane is in the midline. The sagittal plane is parallel to the median plane, but it is also dividing the body into right and left halves, but unequal right and left halves. So this is like this. Now the next plane is coronal plane. The coronal plane is also called as frontal plane. It runs vertically at a right angle to the median plane, but it extends along the whole length of the body. It divides the body or organ into anterior or posterior portions. It is right angle to the median plane. Like we studied, the median plane is in the midline. The coronal plane is right angle to this median plane. So It is also vertical plane, but it is right angle to the median plane. The median plane was dividing the body into right and left halves. The coronal plane, on the other hand, is dividing the body into anterior and posterior halves. The next plane we are going to study is the transverse plane. The transverse or horizontal plane, it runs parallel to the ground. It is situated at right angle to both the median plane and also the coronal plane. So it is dividing the body or any organ into superior or inferior portion. So about the transverse plane, it is present at the right angle of coronal and median and coronal plane. So this is present horizontally and it divides the body into superior and inferior halves. So we have discussed there was a median plane in the midline, the coronal plane, the sagittal plane also parallel to the median plane, and the transverse plane or horizontal plane. This was all about the planes. Now we are going to discuss the anatomical directional terms. So when you learn about anatomy, you hear terms which helps in describing the relative locations of structure in the body. These are called directional terms. All these terms are relative to the anatomical position that we have discussed first. So the anatomical position is used for the reference point for these directional terms. So we will discuss these terminologies one by one. First of all, we will discuss about anterior and posterior. The anterior and posterior terms. The anterior is used for means close to the front of the body, like sternum, the bone in between our rib cage. It is present anterior to the heart or anterior to the vertebrae. For the posterior, it is used for anything which is close to the back of the body. For example, the vertebrae, they are posterior to the sternum, or vertebrae are posterior to the heart. The ventral and the dorsal are the terms which are also used instead of anterior and posterior. These terms are mainly used in the while describing the trunk or the nervous system. So ventral surface is anything towards the belly or the anterior surface. The dorsal surface is anything towards the back or posterior surface or dorsum. So in the nerves, we have often heard about the ventral roots and the dorsal roots. So these are the terminologies which are used instead of anterior and posterior. They are synonyms of these terminologies. The next terms we are going to study are median and lateral. The median is medial is used to refer for the structures present nearer to the center of the body. We will call it as medial. Anything which is closer to the midline is medial. This, as for example, the sternum is present medial to the ribs, and the ribs are present medial to the limbs. So anything which is closer to the midline. The lateral is anything which is present away from the midline. So medial is nearer to the midline or the structure present nearer to the center of the body. The lateral is further away from the midline, like the structure present away from the center of the body. The lateral, for example, for the lateral, the lungs are lateral to the heart. Now the second terms are superior or cranial, inferior or caudal. These terms refer to the vertical axis. Superior means higher, inferior means lower. The cranial or superior means towards the head end of the body or closer to the top of the body. For example, head is superior to the neck. For the inferior, it is any structure which is present away from the head or towards the tail of the body. For example, foot is present at the caudal end. The superficial and deep. The superficial is close to the surface of the body and towards or on the surface of the body, like the skin lies superficial to the muscles. And for the deep, it is away from the surface of the body. So if we go from superficial to deep, we will say that from skin going down to the muscle layer, then to the bones, and then to the organs. It is also true for the skin of the back. Even at the back, muscle like latissimus dorsi, it is deeper to the skin of the back. Like even if the back, skin of the back, then the deeper is the muscles of the back. The terms proximal and distal. Proximal is closer to the reference point, closer to the structure of origin, closer to the trunk. For example, the shoulder, it is closer to the elbow. So we say shoulder is proximal to the elbow. Distal is further away from the reference point, from the structure of origin. For example, the wrist is distal to the elbow. If we talk about the system and the digestive system, the mouth is the proximal part of the digestive system and the anus is the most distal part of the digestive system. In this way, we can also say that the duodenum, it is proximal to the colon. So these are the reference terminologies. If reference to the muscles, we often hear the terms like origin and insertions of the muscles. So the origin is the proximal attachment of that muscle. The insertion is the distal attachment of that muscle. Mostly the origin is present at the unmovable surface of the bone. The insertion or distal attachment is present at the movable surface of the bone. Apart from these standard terminologies, there are some middle terms used. For example, the middle or medius, it is an adjective indicating a position between the superior and inferior or anterior and posterior. The middle is the intermediate position. And so the intermediate word term is used commonly for a position between the lateral and the medial. Many times we hear some combination of these standard terms like the superior lateral, inferior medial, anterior inferior, posterior superior. Any other combination of the standard terms may be used to show the intermediate position in much the same way as the points of the compass. For example, the superior lateral means the anything which is present superiorly but on the lateral side. Inferior medial means anything present inferiorly but on the medial side of it. So this is the intermediate terminologies which you will hear further in your studies. So don't get confused. These terminologies can be used in the combination forms for more accuracy. So this was the video of directional terms. Next we will discuss terms for the position of the body and terms of the movements. Inshallah. Thank you so much. Don't forget to subscribe, comment and like.